So hello everyone, welcome back to the channel, that is AMS MBBS lectures. In today's session, we'll be covering a short topic from CVS Microbiology, and that is your Bartonellosis, guys. Again, this topic I'll be describing it under the following subheadings as introduction. The three important pathogenic species of Bartonella, that is Bartonella henselae, Bartonella quintana, and we also have the Bartonella bacilliformis. Okay, and then we're going to discuss the lab diagnosis and the treatment part of Bartonellosis, guys. Okay. So now see, when I say Bartonellosis, it is caused by the species Bartonella. Now this Bartonella is a facultatively intracellular fastidious organism, and on gram staining it is a gram negative bacteria. ठीक है, सब पिंक या रेड कलर का अपीयरेंस शो करेगा, ग्राम नेगेटिव है कहीं ना कहीं, इट इज नॉट रिटेनिंग द प्राइमरी gram stain, guys. ठीक है, and it also have the ability to invade the mammalian cells and RBCs को invade कर सकते हैं ये वाले. ठीक है, अब Bartonella species, when I say, when this Bartonella, this bacteria has multiple species, जिसमें से only 3 are the pathogenic to human. Only 3 are pathogenic to human. That is your Bartonella henselae, B.quintana, and we have the Bacilliformis, guys. ठीक है, now out of these 3, guys, okay, the first one, that is B.henselae, is something that is transmitted by the cats. है ना, exposure to cats like a cat scratch or a bite will transmit the bacteria called as Bartonella henselae and may result into conditions like the cat scratch disease or bacillary angiomatosis or bacillary peliosis जैसी condition हो सकती है. The next species, okay, that is your Bartonella quintana, is transmitted by louse and may result into conditions and it causes conditions like your trench fever and some other conditions like bacillary angiomatosis, chronic bacteremia, and endocarditis. Okay? The last species, that is Bartonella bacilliformis, is transmitted by the Sandfly, and that too there is a name to remember called as Lutzomyia. Okay, that is the one which transmits Bacilliformis, and it causes diseases. Okay, the very important biphasic disease. Okay, when I say biphasic, the initial phase is called as the Oroya fever or the Carrion's disease, and then the late phase or the second phase is what is referred to as the Verruga peruana, guys. Okay, and it may also cause other conditions like your bacteremia and endocarditis. Clear? Now let me describe each bacteria, okay, each individual species separately, starting with the first one, that is your Bartonella henselae, guys. Bartonella henselae, we know it is, अभी हमने table में देखा, it is transmitted by a cat scratch or a cat bite, guys. Okay, and it may cause the following 3 conditions. Okay, now the first one, that is a cat scratch disease, is something that is manifested mainly by regional lymphadenopathy and your painless papule at the site of cat scratch. ठीक है, लिम्फ नोड का इन्वॉल्वमेंट हो सकता है, दैट इज कॉल्ड रीजनल लिम्फेडिनोपैथी, एंड ऑफ कोर्स जहां पे भी कैट ने स्क्रैच किया या बाइट किया वहां पे पैप्यूल देखने को मिल सकता है, पेनलेस पैप्यूल और अ स्किन लीजन कैन बी सीन ओवर देयर. ओके, दीज टू फर्स्ट एंड द सेकंड, दीज आर लाइक द मेन और द कॉमन सिम्टम्स. ओके, दीज आर द मेन or the common symptoms seen in case of cat scratch disease. Okay, and the remaining like your hepatitis, splenitis, or retinitis, these are atypical features seen in case of cat scratch disease, guys. Okay, the second disorder caused by Bartonella henselae is the bacillary angiomatosis. See, please remember that both these conditions, that is bacillary angiomatosis and bacillary peliosis, both of them are angioproliferative disorders. Okay, it is mentioned that both of them are angioproliferative disorders, guys. Okay, but okay, the differentiating feature is that your angiomatosis is something that is characterized by some neovascular lesions, okay, which is involving organs and skin के ऊपर ऐसे multiple lesions can be seen, okay, can be seen in case of bacillary angiomatosis. And bacillary peliosis is a condition which is going to involve mainly the liver and the spleen. Here is a very important cut section of the liver showing multiple blood filled cavities. You can see multiple blood filled cystic cavities can be seen in this case, and that is what is called as your liver peliosis seen in case of bacillary peliosis, guys. Okay, so Bartonella henselae is done. Another species to discuss is the Bartonella quintana, and when I say Bartonella quintana, it is transmitted by a louse, guys. Okay, louse is the transmitting agent over here. It is a vector that is going to transmit Bartonella quintana and cause the very important disorder, that is trench fever. When I say trench fever, guys, it is something that is has occurred during the World War I. Okay, it is something that has occurred during the World War I, and that too where and in trenches. Okay, what is this trenches? You can look at the images shown over here, guys. Again, so it is nothing but a kind of a tunnel that is, or a passage that is dug up in the ground. Okay, where the these people used to stand over there and stay in groups in order to attack by hiding, guys. Okay, so can you see that people are crowding over here, and the agent that is causing this disorder is a louse, and because of this okay, crowding or too many people in a very close proximity, the disorder, the louse can easily spread this organism over here. Okay, so this is what I want to show, that is World War I के दौरान during your trenches we can appreciate this disorder. मतलब ये disorder तभी हुई थी, okay, during World War I guys, ठीक है. And clinically it is a mild febrile illness, okay, यानी कि fever होगा इसके अंदर जो 5 days. Pay attention to the term, that is the fever lasts for 5 days and again, okay, every 5 days the fever is going to recur guys, ठीक है. So it's an episodic condition which is going to recur every 5 days and therefore your trench fever is also called as a 5 days fever guys. Clear? Now see, World War I के वक्त ही it was something a common condition, but then later on it became silent for a lot of years, okay, for decades it became silent, but recently the disease has re-emerged in USA में फिर से हुई है. And we are talking about Bartonella quintana. Apart from trench fever, it may also cause conditions like bacillary angiomatosis, chronic bacteremia and endocarditis जैसी condition भी cause कर सकता है ये. The last pathogenic species under Bartonella, that is your Bacilliformis. Bacilliformis causes, okay, is transmitted by the sandfly. What was the name? Lutzomyia. Yes or no? The name of the sandfly was Lutzomyia, that is transmitting Bartonella Bacilliformis, and it causes again the very characteristic biphasic disease, guys. Okay? Why it is called as a biphasic disease? Because it is having 2 phases. Okay? Biphasic disease, 2 phases. The first phase is something called as the Oroya fever or Carrion's disease. It is nothing but the initial manifestation. Okay, it is the initial manifestation which is definitely bacteremic. Bacteremic means bacteria, that is your Bartonella Bacilliformis, would be present in the blood, and it is a systemic condition guys. It's a systemic illness which may present with or without anemia. Clear? Then we have something called as your Verruga peruana. It is a late manifestation, or we can say the second phase. Okay, so it is like the late manifestation of biphasic disorder, and it is again characterized by some cutaneous vascular lesion के साथ characterized है. And if we are discussing Bartonella Bacilliformis, we know other conditions caused by it is your bacteremia and endocarditis, guys. Clear? So I have the discussion of the 3 important pathogenic species of Bartonella is clear. Now let's have a look on the lab diagnosis with respect to Bartonellosis, guys. Okay. So first thing, which specimen we are going to collect? We can collect blood sample ले सकते हैं, or we can collect biopsy. Okay, biopsy किसका? Lymph node का biopsy और skin biopsy sample can be collected, guys. ठीक है. Now once the specimen is collected, we are going to do the microscopy. Microscopy मतलब we are going to perform some staining techniques, guys. ठीक है. Which stain are we using? We are using the Vardin Starry silver nitrate stain. Vardin Starry silver nitrate stain. This is what we can use, and along with this we can also use another stain, and that is called as the immunofluorescence stain. It is a fluorescent stain, guys. Immunofluorescence stain. Okay, these stains we can use, okay, for microscopy, and these, okay, staining techniques are the one which are going to detect it detects the Bartonella henselae, and Bartonella henselae under the microscope from a lymph node smear. Okay, you have to prepare a smear using the lymph node, stain it with the following stains, and we can definitely detect the organism, that is Bartonella henselae, under the microscope. ठीक है. Then apart from microscopy we can do culture कर सकते हैं इस organism का. So if I am doing a culture, so we are doing the कौन सा blood culture media? We are using blood agar as the culture media in order to culture this Bartonella species over here. Okay, and incubation करना होता है. You have to incubate this thing at 37 degrees Celsius for nearly 12 to 15 days के लिए incubate करना is very important, guys. Okay, you have to incubate it at 12 to 15 days. Clear? Antibody detection करना है, तो we have very important test, that is your IFA, or we can go with the EIA. IFA stands for indirect immunofluorescence assay, and EIA like your enzyme immunoassay. Okay, ये methods पे based test available होते हैं to detect species of your Bartonella henselae and your Bartonella quintana. Okay, so this is separate tests are available. On the basis of these methods, it is available to detect the antibodies. Okay, and definitely lastly, molecular method, polymerase chain reaction, PCR can be used to amplify genes like the 16S rRNA. Okay, 16R RNA gene can be amplified using this thing, guys. Okay, so that was all for something called as the lab diagnosis. Now let's have a look on the treatment for Bartonellosis. Okay, so please remember, अगर cat scratch disease होता है ना, तो we usually not indicate treatment. Okay, it is not, see, treatment for cat scratch disease is not indicated routinely, and it is okay. मतलब medications cat scratch disease में सिर्फ तब देते when there is extensive lymphadenopathy. Okay, so whenever there is an cat scratch disease, we usually do not give any treatment. Okay, we do not usually give any medications directly until unless the case is characterized by extensive lymphadenopathy. In that case, we can prescribe azithromycin. Okay, we can give azithromycin for nearly 5 days. We can prescribe. Okay, azithromycin for 5 days can be given. Okay. Now in bacillary angiomatosis, guys, we can give drugs like erythromycin. This is a condition in which we can definitely give drugs, that is erythromycin can be given, or we can give the very important drug, that is your doxycycline. Okay, doxycycline can be given, and that too for a duration of 3 months we have to give the drugs, guys. So we have described Bartonellosis under all the following topic, okay, under the following headings, and that is it for this session. If you found this content useful, then do like, share, and subscribe to the channel. If you have any questions or queries, then do comment down, and see you on the next one. Bye bye.